Heart disease is the #1 killer of women in the United States. In order to lower your risks, it's important to know the warning signs and the risk factors. We're getting a lesson on both of those things today with the cardiovascular experts who are sponsoring this segment, and Dr. Raj Dave is joining me. What a pleasure.
Thank you.
Absolutely. Welcome back.
Thank you very much.
So how can you tell us about a woman's risk of heart disease?
So men and women both are affected by the heart disease. However, there are certain unique things that affect women. And that's why we are talking about that today, that women, even younger women now, between age 35 and 55, have higher incidence of heart disease than it used to be. And there are these unique signs and symptoms that can be presenting symptoms for women, and that can really be a challenge in diagnosis. And there's a lot of misconceptions and misdiagnoses that can occur, and that's important for us to talk about today.
Well, what are the signs of a heart attack specifically?
So in general, men and women both develop chest pressure majority of the time, and that's really the principal fundamental symptom for heart attack. However, women sometimes can present their heart disease as shortness of breath, cold sweats, fatigue, lightheadedness, and nausea, as well as back pain and jaw pain. So here's the graphic that you can see on the screen, which talks about the differences, that some of these symptoms that can be a presenting symptom in women that is unlike having a normal presentation like a chest pressure.
Right. Sometimes that's just stress, but you don't know?
That's correct. And that's why you have to be your own advocate.
Yes, we have to be our own advocate.
Yeah.
You mentioned risk factors for the heart disease and seeing them develop sooner, though, in younger women. Why? What are those risk factors?
There are three main issues that affect women and affects, in an early age, such as smoking. So the statistics shown that women, once they start smoking, it's difficult for them to quit than men. Estrogen, while the women are young, is a protection against high bad cholesterol. However, once they reach menopause, that protection is lost, and now the cholesterol becomes very important risk factor for them. And then high blood pressure, which frequently gets unrecognized. And as you know, that now we're treating trying to achieve lower and lower blood pressure than we used to. Now we want blood pressure to be less than 130/80. So many of our population, which is affected by obesity and dietary habits, sort of live in a pre-hypertension hemisphere. And those are three key factors that are unique. And that's why we are seeing women getting affected earlier.
Yes, and I know that a lot of women go through a lot of stages of life, and it does affect them, and sometimes we ignore that. What's your best advice when you say, I might go see a doctor, get a screening?
Yeah, so it's extremely important, and this is the most important point for today, is that you have to be your own advocate, because your symptoms can be unique. They don't necessarily have to be like a chest pressure. So you want to get screened, because sometimes even the healthcare provider can misdiagnose women's symptoms of heart disease. And you really need to insist on getting screened. Otherwise, you sometimes can miss it.
Well, knowledge is power, I think, and then you have a little control over your health. But I also believe that at this point of life, a lot of people in my time of life think that it only happens to older people, but it happens to younger people too. So,
absolutely does.
Let's not fool ourselves,
Absolutely
Well, Dr. Dave, this has been so much fun hearing from you. I learn something every time you come in. And how can patients contact cardiovascular experts?
So they certainly can go to our website called cardiovascularexperts.com. There's lots of information about heart disease in women, or they can call and make an appointment, and we're happy to talk to them.
Yes, and on your screen you can see that it is in Camp Hill, 3040 Market Street, cardiovascularexperts.com. Do call them at 717-727-0480, and you'll get to meet Dr. Raj Dave, and it is such a pleasure, and you'll find that out too. It's going to be wonderful for you to check yourself. I'm going to do so.
Thank you very much.